Some doctors say they expect a rise in numbers of cases of flu, COVID, and other respiratory illnesses this month with schools back in session.
Our Abigail Martin is here with advice from a local doctor who is seeing a spike in cases. Abigail.
The Hamilton County Health Department's website reports 64 new cases of COVID-19 today, but there are other illnesses impacting our area. Dr. Jensen Hyde from Erlanger Hospital advises you to be aware of your symptoms and take precautions as we see a spike in cases.
We're right in the height of cold and flu season. You've seen two really huge spikes right after Thanksgiving and right after the holidays.
Dr. Hyde says seasonal illnesses, common cold viruses, COVID variants, and the flu are actively spreading in high volumes in the community. She says she has already seen an increase in respiratory viruses and death rates in the county.
This mirrors national trends as well. So we've seen an uptick. I think we anticipate that will continue throughout the next several weeks and then hopefully downtrend in the next 4 to 6 weeks.
Dr. Hyde says nationally, community transmission is up to 20%, but at-home testing makes professionals believe that is an underestimate. She says in pre-COVID years, we were not as aware of safety measures. Now, we know of effective precautions, including strategic masking. Dr. Hyde says if you're in a crowded space, not feeling your best, or recovering from an illness, it isn't a bad idea to wear a mask. Another effective tool is to pay attention to ventilation.
If you do have to be sort of in an indoor space or if you're hosting something indoors, really pay attention to, can I open doors? Can I open windows? Can I turn on ceiling fans? It makes a huge difference for spread of respiratory viruses.
When it comes to being aware of your symptoms, Dr. Hyde says respiratory viruses can be tricky because of similarities. Stuffiness, congestion, fever, chills, and cough can be seen with the different illnesses. But she suggests getting tested, staying up to date on vaccines, and staying home when you're sick will help you and others.
We've seen relatively low uptake of the bivalent Omicron COVID vaccine, which is really effective against the strains that are circulating now.
Dr. Hyde urges people to visit your primary care physician or an urgent care if you're sick. She says ERs are being overloaded, and they ask everyone to help preserve those resources for true emergencies. Live in studio, I'm Abigail Martin, Local 3 News.